Hello everyone, myself Jyothi, Assistant Professor, Department of Medical Surgical Nursing, Yenepoya Nursing College. Today in this session we will be learning regarding urinary tract infections. Learning objective of this session are: learners will be able to define urinary tract infection, list down the types of urinary tract infection, enumerate the causes and risk factors for urinary tract infection, explain the pathophysiology of urinary tract infection, enlist the diagnostic evaluation of urinary tract infection, and explain the management of urinary tract infection. A urinary tract infection is an infection in any part of the urinary system. Either it may be in the kidneys or maybe in the ureter or in the bladder and the urethra. Most infections involves the lower urinary tract. It involves the bladder and the urethra. The definition says that a urinary tract infection is an infection that affects any part of the urinary tract, including the kidneys, ureters, bladder or urethra. Next, move on to the classification or types of urinary tract infection. It has been classified into two types: upper urinary tract infection and the lower urinary tract infection. Upper urinary tract infection. Here the infection has spread into the upper urinary tract, which involves acute pyelonephritis, chronic pyelonephritis, interstitial pyelonephritis, and if there is an infection, there is a collection of pus in the kidney, that is called as renal abscess and perirenal abscess. And in the lower urinary tract infection, which involves cystitis, that is nothing but inflammation of the urinary bladder, urethritis and the inflammation of the prostate, that is termed as prostatitis. Next we will see about the risk factors for the urinary tract infection. There are different risk factors which are predisposing to the urinary tract infection. The first one is the age and the sex. Here usually the women are more prone to get a urinary tract infection compared to the males, because due to the shorter urethra, females are more prone to get a urinary tract infection, and age also they are usually affecting between 20 to 30 years, and other factor is during the postmenopausal period, because of due to the estrogen, low level of estrogen, they are more prone to get a urinary tract infection. Coming to the genders, compared to the females, males are less prone to get a urinary tract infection, and in case of males, after the age of 65 years, because of due to the enlargement of the prostate gland, there may be a chance of leading to the urinary tract infection. And second risk factor is a pregnancy. During a pregnancy, due to the hormonal changes and maybe due to the pressure on the growing uterus on the bladder, pregnant women are more prone to get a UTI. And third risk factor is poor hygiene. If the individual or the person is not following a good hygienic practice, they are more prone to get a urinary tract infection. And next risk factor is SGLT2 inhibitors. Because of these SGLT2 inhibitors, it will prevent the reabsorption of the glucose from the urine. As a result, what will happen? There is a more productions of glucose, and which will lead to the urinary tract infection. Next risk factor, that is previous history of urinary tract infection, and last one is maybe due to the sexual activity. Unprotected or the frequent sexual intercourse also may be leading to urinary tract infection. So these are some of the risk factors which are predisposing to the urinary tract infection. Next, moving to the etiological factors. The first causative factor is a bacterial infection. The bacteria which is responsible for causing a urinary tract infection, that is E. coli. And second factor is due to the urinary catheterization. What will happen during a catheterization? The bacteria may enter into the urethra and which may cause the infection. And third causative factor is the urinary tract abnormality. It may be due to kidney stone or it may be due to vesico-urethral reflux. What is happening here in this condition? The urine is backflow into the kidney, and other causes like urinary tract abnormalities such as enlargement of the prostate gland or the prostatitis. And next factor is a incomplete bladder emptying. If the person is not emptying the bladder, the urine will be stagnated there only. Then there may be a growth of bacteria and which leads to the UTI. And next causative factor is a weakened immune system, such as in case of HIV or in case of malignancy. Their ability to fight against the infection will be reducing. Next factor is the menopause. As I told, in case of postmenopausal women, there is a reduction in the estrogen level. So this is also will be leading to UTI. And other etiological factors, infrequent urination, urinary tract obstruction, and the reducing the fluid intake or the dehydration. So these all causative factors will be causing to urinary tract infection. Next, we will see about the pathophysiological changes which is occurring in a patients with urinary tract infection. Due to the various etiological factors, what will happen here? The bacteria will be ascends the urethra and which leads to the lining of the urinary tract. It will becomes inflamed. And as a result of this, because of the inflammation, the maturation reflex triggers. Maturation reflex, it is nothing but it is a process that is controlling the urination that will be triggers and which will lead to the various clinical signs and symptoms such as increase in the urgency, increase in the frequency and causing pyuria, dysuria, etc. Next, we will see about the clinical features, how the UTI is affecting the body. The person with UTI may be experiencing a chills, back or side pain, frequent urination, burning while urinating, and there will be a changes in the color of the urine. There will be urine will be look like a cloudy urine, pelvic pain, nausea, vomiting and fever. These are the general signs and symptoms we can observe in the patient with UTI. Next, depends on the types of urinary tract infection. We will see what are the clinical features will be observed in a patient. The first one is the dysuria, that is nothing but painful or burning sensation during a urination. And there will be an increased frequency of the urine. The patient is or the person is or the individual is frequently passing a urine. There is an increase in the frequency. And next will be the urgency to urinate. The person will feel a sudden strong urge to urinate. Then next will be the nocturia, okay, waking up frequently during the night to urinate. Other than that, there will be a hematuria, presence of blood in the urine, and as I told, the urine will be cloudy or foul smelling urine, and patient may experiencing a lower abdominal or pelvic pain or discomfort, and there is a feeling of incomplete bladder emptying even after urination. These are the symptoms we can observe in the lower urinary tract infection. Next, move to the upper urinary tract infection. If you are not treating the lower urinary tract infection, what will happen means infection may spread into the upper urinary tract. It may spread into the kidney. Kidney infection is called as upper urinary tract infection or the pyelonephritis. So, with the upper urinary tract infection, the patient will show the symptoms of fever and chills, that is often high fever. And there will be a flank pain in the backs or side, typically on the lower ribs or near the kidneys. And person also experiencing a nausea, vomiting, generalized malaise or fatigue, and there will be a costovertebral angle tenderness. That is nothing but the patient will feel the pain upon tapping the area on the back over the kidney. Next, there is a signs of systemic infection such as confusion or hypotension or drop in the blood pressure that we can see in the severe cases. Next, moving on to the complications. Okay, so these UTI that are not treated promptly could spread, or if you left untreated, what will happen means, and it will spread into the entire urinary tract system, and it will becomes the cause for getting a renal failure. So that is the first complications of urinary tract infection. And second one is the urosepsis, that the bacteria may invade or enter into the urinary system, and that will result in sepsis or the infection. So these are the major two complications, renal failure and the urosepsis. Next, we will see how we can diagnose the urinary tract infection. That may be through the thorough history collection, by collecting the history from the person and performing through the physical examination, through the routine urine analysis, and by performing or doing a routine culture, urine culture. In that, with the urine culture, we can detect the specific microorganism which is causing or responsible for UTI, and doing a blood test, various blood tests. It may be by checking the WBC count, ESR count, CRP count, CBC count, etc. And also the last diagnostic investigations, that is imaging studies, may be through ultrasonography, CT scan and the MRI. So performing these all diagnostic tests, we can reveal the, or we can diagnose the urinary tract infection. Next, move on to the management. The first line of treatment for most UTI involves the use of antibiotics, but the choice may be depends on the suspected pathogens and the local resistance patterns, and whether this infection is complicated or uncomplicated. In case of uncomplicated UTI, that is nothing but cystitis, the first line of antibiotics, which includes trimethoprim sulfomethazole. Other than that, nitrofurantoin, especially we are for the uncomplicated cystitis. Then other than that, amoxicillin. Okay, if the patient is allergic to the sulfur or the nitrofurantoin, we are going with the amoxicillin, and the duration for these drugs usually for the 3 to 7 days, that is depending upon the antibiotic and the patient's level. Next, coming to the complicated UTI. The complicated UTI, as I told, which includes pyelonephritis, recurrent infection or infection in the patients with other comorbidities condition. Here we are using a broad spectrum antibiotics, which includes fluoroquinolone, that is such as ciprofloxacin and the levofloxacin. Then other than that, aminoglycosides. Here the duration for prescribing the antibiotics, that is typically 7 to 14 days, that is depending upon the severity of the infection. That is about the antibiotic, that is the first line of treatment. And second is about supportive care. Here, which includes the pain management. Here the drug of choice, we are using a urinary analgesics. So, which includes the phenazopyridine, which can help to relieve the dysuria in case of painful urination. Then other than that, acetaminophen or ibuprofen for general pain and fever. So, supportive care not only involves the pain management, which also includes the hydration and adequate rest. And third management, which includes the non-antibiotic measures such as probiotics, urinary alkalizers and cranberry products. These all non-antibiotics measures will help to kill the bacteria, or it will prevent the harmful bacteria, and also it will help to flush out the bacteria from the bladder. Next, moving on to the surgical or invasive intervention. If there is any anatomical abnormalities such as I mentioned, kidney stone, strictures or urinary tract obstruction, surgical intervention may be necessary to address the underlying causes. And second one is indwelling catheter, proper catheter and removal when possible to prevent catheter-associated urinary tract infection, what we are saying as COTI. Next, moving to the preventive measures. So, the preventive measures for a patient with urinary tract infection: empty the bladder fully when urinating, urinate after sexual intercourse, wipe from the front to back, drink plenty of water daily, drink cranberry juice, avoid frequent use of diaphragms and the spermicide, use of lactobacillus probiotics which will help to flush out the bacteria. Do not delay urinating when the need arises. Avoid irritation of the vagina with feminine hygienic products such as Duchess or sprays, strong soaps or scented panty liners. Use topical estrogen in postmenopausal women. As we know that in case of postmenopausal women, there is a decrease in the estrogen level. So, you have to advise the patient to use the topical estrogen in the postmenopausal women. Use the antibiotics in case of recurrent infections as prescribed by the physician. To conclude, the urinary tract infection is the second most bacterial infection. Women are more at risk to get UTI than men due to the shorter urethra, and signs and symptoms of UTI are easy to assess. However, there is a difficulties in the treatment because of the recurrence and resistance to antibiotics. Patients should be consulted to use antibiotics as prescribed and follow the preventive measures to avoid recurrence, chronic UTI and the complication. Complicated UTI such as pyelonephritis should be treated properly and correct of the complications of the other abnormalities. I hope this session will be useful for you. Thank you.